Good afternoon, everyone. This is Sarah, recognized your clinical pharmacist. So another section of updates from new hypertension guidelines. So I want to include 5 more changes that they recommend, especially using the prevent calculator, which I'll be publishing another specific video on the prevent calculator for the use of it and how it's indicated for to use. So one of the changes in initiation of the medication therapy to lower the blood pressure in addition to the lifestyle modifications and interventions recommended for all adults with average blood pressure of 140/90, and or for selected adults with average blood pressure 130/80 who have clinical cardiovascular disease, previous stroke, diabetes, or chronic kidney disease, or increased 10 years predicted cardiovascular risk defined by the prevent calculator. In adults with average blood pressure above 130/80 and at lower 10-year cardiovascular disease risk defined by prevent of less than 7.5. Initiation of medication therapy to lower blood pressure is recommended if average blood pressure remains above 130/80. For all adults with stage 2 hypertension, the initiation of antihypertensive drug therapy with 2 first-line agents of different classes in a single pill fixed dose combination is preferred over 2 separate pills to improve adherence and reduce time to achieve blood pressure control. For home blood pressure monitoring, combined with frequent interactions with multidisciplinary team members using standardized measurement and treatment protocol, and home measurement protocols is an important integrated tool to improve the rates of blood pressure control. Lastly, severe hypertension in non-pregnant individuals defined as blood pressure above 180/120 without evidence of the acute target organ damage should be evaluated and treated in the outpatient setting with initiation, reinstitution, or intensification of the oral antihypertensive medications in timely manner. So again, these are a few other changes in the new hypertension guidelines, which emphasizes the use of blood pressure medications correctly with accurate dosing and aggressive dosing using the prevent calculator for the risk of the calculating the risk of the patients based on their cardiovascular disease and their treatment goals based on the new guidelines. So again, I've included the link over here for you to see. Make sure to comment on the video with your questions on these new hypertension guidelines and changes, and I'll be happy to answer any questions you may have. Hope you enjoyed this video. As always, stay safe and take your medications.